G'day everyone, it's Paul. This unknown effusion specimen is from a 58-year-old female patient. We received 200 mils of bloody fluid, and the clinical notes queried pleuropericarditis, query malignancy, query autoimmune, maybe SLE or rheumatoid, and query infection. So what's your diagnosis based on what we have looked at? Well, it was a pretty cellular specimen. It contained mesothelial cells, macrophages, and lymphocytes. It wasn't especially inflammatory, but there were definitely moderate numbers of background lymphocytes present. Most of the cells appear to be mesothelial, and they showed typical mesothelial cell features, fairly homogeneous cytoplasm in a moderate amount with a typical NC ratio and cell size of a mesothelial cell. They showed really no cytoplasmic vacuolation, a little bit of degenerative sort of bubbly small vacuolation in the diffquex, but certainly no hard-edged secretory looking vacuoles. The nuclei were mostly central and showed fairly bland chromatin. Nucleoli were prominent in some of them, but mostly they were fairly small. These were mostly arranged as isolated cells, but there were loose groupings present. I showed you a few of those, and they showed a typical mesothelial pattern. So by that I mean they were flat, lacking three-dimensionality, certainly lacked organization in terms of formation of a community cell border or a definite acinar arrangement. They showed fairly uniform looking cells, and there was definite cell windows present in the groupings as well, and again no large cytoplasmic vacuolation. Nuclei really were quite uniform, and I think one of the keys to recognizing reactive mesothelial cells is that hypochromasia. So they showed very bland pale chromatin on the pap stain slides, the nuclei really not standing out from the cytoplasm at all, and the diffquex really showed very little variation in nuclear size and shape, quite uniform. So this was really all consistent with just a benign mesothelial cell proliferation. We did a cell block, and this showed very similar findings, so really no groupings of cells at all that were organized in a glandular fashion. Prominent nucleoli in some of them and little cell windows, but in keeping with benign findings. So I hope you enjoyed that case. Thanks for watching.